Prior to the pandemic, telemedicine was predominantly utilized for specialized purposes, including specialty consultations and chronic disease management. However, COVID-19 greatly sped up the acceptance and made us more aware that it even existed. As community, we all quickly adjusted to guarantee ongoing access to treatment and to minimize exposure to the virus. Governments, healthcare providers, and insurance companies also adapted quickly to ensure continued patient care. My presentation will explore the evolution to telehealth, ethical concerns regarding it, legal frameworks, and its impact on the healthcare delivery and administration, including research from peer-reviewed and credible resources. Health informatics is the field where technology in health is applied, and telehealth is one of the most important areas in this department. Remote care delivery is enabled through secure messaging, video conferencing, and other secure digital communication tools. When EHR integration, providers can share information seamlessly, fostering continuity of care. Also, healthcare providers can monitor vital signs and chronic conditions remotely via remote patient monitoring. Public health policymaking and research can guide the telehealth data. Reliable sources, including peer-reviewed papers, emphasize how important telehealth is to contemporary machine.
Before COVID-19, many clinicians were unable to provide online medical services. However, widespread acceptance of telehealth was impeded by the way it was supported, bombarded by limited policies. More importantly, given the technological, I can't say that word, difficulties and legal demands, execution became challenging. Telehealth's main uses were in rural areas and included linking patients to specialists via the internet, helping sufferers manage chronic diseases such as diabetes and high blood pressure. In this way, on top of the lack of insurance coverage, also put providers and patients off using telehealth services. Many reliable scholarly sources have offered information to back up these gaps.
The COVID-19 pandemic led to a dramatic surge in telehealth usage. Social distancing standards made it in-person visits difficult, leading to rapid expansion in telehealth consultations. Government agencies such as Centers for Medicare and Medicaid Services issued emergency waivers to ease restrictions. Insurance companies expanded coverage, enhancing accessibility of telehealth services. The transition was particularly pronounced in primary care and mental health, where remote consultations became standard practice. Both patients and professionals swiftly adjusted, acknowledging the advantages of telemedicine. Research findings underscore the rising usage trends and policy modifications. Following the initial increase in telehealth use leveled off, although it is still greater than what it was before the epidemic. Now that several temporary regulations have been debated, lawmakers are considering making them permanent. It is becoming more usual to see hybrid models that combine in-person and telehealth care. Demand is still high. While demand remains strong, new challenges have emerged, such as disparities in access to underserved populations and digital literacy barriers. Scholarly sources have offer scholarly sources offer insights into these ongoing policy discussions. In telehealth, ethical questions center on safeguarding patient information and guaranteeing fair access. Privacy in telehealth, since telehealth depends on digital communication that might be hacked easily. Telehealth accessibility varies, especially for low-income rural people. Patients have to realize the restrictions of telehealth. Hence, information permission is very necessary. Providers also have liability issues. Many patients struggle with technologies required to obtain telehealth services. Peer-reviewed research offers angles on moral dilemmas. Legal considerations for telehealth include compliance with Health Insurance Portability and Accountability Act (HIPAA), ensuring patient data remains secure. Medicare and Medicaid compensation for telehealth services is under control by CMS rules. Laws pertaining to state licensing offer difficulties since providers must be licensed in the state for the patient lives in. The FDA watches medical devices and applications applied in telehealth, while professional organizations like AMA provide ethical guidelines. Peer review literature supports the importance of these regulations.